talk by Dr. Rizana on counseling a newly diagnosed glaucoma patient. Over to you, Rizana.
Good morning, everyone. Today, my topic of presentation is counseling a newly diagnosed glaucoma patient. So, as we all know, glaucoma is a sneak thief of vision. Before understanding the importance of counseling, it is very important to know the barriers in successful treatment of a case of glaucoma. There are disease-centric issues as well as patient-centric issues. Patient-centric issues include inadequate awareness among the patients, non-adherence to treatment, non-affordability of treatment. All these issues can be sorted out with a proper counseling. So the purpose of counseling is to improve the success rate of treatment by making them aware about the disease, to help them accept the prognosis, to improve compliance to medical management, and to find out exactly what the patients need, and to refer them to low vision services and help them to improve their quality of life. When to counsel is the next question. Actually, the first session can be planned immediately after the diagnosis is confirmed. 10 to 15 minutes of dedicated counseling can have a great impact on the long-term outcome of the disease. It has to be in mother tongue, and further sessions can be planned as often as needed, and the frequency of that can vary from case to case. The examining clinician is the ideal person to counsel, but owing to the busy nature of practice of Indian clinicians, this is not possible many times. So the glaucoma care team can train a person to take up this role. It can be a nurse, a social worker, an optometrist, a postgraduate, or a fellow. Anyone can take this role, but the person has to be approachable and skilled at talking to the patients and bystanders, and he or she should have a reasonable understanding of the disease and its treatment. And the clinician should clearly convey the details regarding the patient to the counselor, because the ultimate responsibility is with the clinician. And it is very important to include family members as well, because defective vision is not without any evident findings like a white pupil, as you see in a case of cataract. And often the adverse effects of anti-glaucoma medications like red eyes is usually many times misinterpreted as alcohol abuse. All these problems are there. So it is very important to include family members when you're counseling them. And constant visits and expensive treatment are without any evident improvement in vision. So it might be difficult for the patient to explain and convince the family members. So when explaining about the disease, do not overload with facts, and ask them how much they know about the disease, and explain regarding genetic predisposition also, so that they can encourage their relatives to get screened. And it might be needed to explain repeatedly, especially when you're dealing with a patient who is denying. Every time you have to present in different methods to avoid monotony, and when dealing with them, avoid harsh languages and give them time and space to go through various stages of grief. And it's very important to encourage them to be compliant about their medical management. The counselor has to ask about the frequency of medications, to demonstrate how they instill it, to inquire about any barriers if present in proper installation of medications. All these are very important. And we can encourage them to keep reminders so that they don't miss medications at the correct time. And explain about the possible adverse effects of the medications which are prescribed to them. And to improve the quality of life, it is important to guide them to low vision services also, to get equipments and training to make best use of their available vision. And it's important to encourage them to join support groups for people with glaucoma. And peer mentoring is a technique in which a patient is connected to another one with a similar condition, so that they'll get guidance towards developing self-help and personal grooming skills. And this is a methodology which you can practice while counseling. Ask the patient what they know about glaucoma. So then you will have to explain about the multifactorial nature of the disease, and tell them that IOP is the only modifiable risk factor. This helps them to avoid unnecessary anxiety and encourage them to take medication seriously. And inquire about whether they know about the symptomatology with which patients present. This will help them to educate others. Ask about the aim of treatment of glaucoma. Just tell that this is not for improving vision, but with regular follow-up, they can keep the disease under control. And tell them that these medications and follow-ups are to be continued lifelong. ask about family history so that they can encourage their relatives to get screened, and ask about whether they are seeing some patterns or objects which others are not seeing, and explain to them about this phenomenon called Charles Bonnet phenomenon, and tell them that this is nothing to worry about. If you want, I can explain this to your family members so that they won't misinterpret you as malingering or as blaming to have mental illness, etc. So, in nutshell, patience and consistency is the most important thing in a successful treatment of glaucoma, and this can be achieved with the proper counseling. Thank you so much.
Thank you, Rizana.